Hello, my name is Emma Remy, and today I'll be doing my NG skill video. I'll be practicing general principles and safety practices throughout this whole skill today. First thing I'm going to do is just make sure if we were administering medications that we'd be doing the 11 rights and 3 checks. But I'm going to look at my MAR and confirm that this patient is getting this NG tube. I'm going to identify them with 2 patient identifiers, making sure they are the patient getting this NG tube. So the first thing I'm going to do is perform hand hygiene. And I'm going to do my measurements for my tube placement. I'm going to do this by getting our tube out. And we're going to measure from the tip of the nose to the earlobe, and then earlobe to the xiphoid process. Now that we have that, come over here. And then according to facility policy, you can add a few inches, usually like 5 to 10. Now once I've done that, I have my placement here. I'm going to mark it. With a marker. Alright. I'm just going to set this aside. Now that we have that measured, I'm going to get my patient comfortable, make sure that they're aware they're getting an NG tube today, and explain the procedure to them. The chuck pad over their gown. I'm going to provide them with a tissue and a cup of water for the procedure. Now that we have that, I'm going to perform my hand hygiene. And don clean gloves. And now I'm just going to go ahead and get my tape ready for our first securement that we put on after we insert our tube. Alright, so now that we have all of that done, I'm going to lube my tube, the end of my tip of my tube, 2 to 3 inches down with some lubricant. Alright. So now I'm going to have my patient tilt their head back, and we are going to insert this tube in one nostril. Alright, and now that once it's hit the pharynx, usually they'll gag or anything, and we will tip their chin to their chest. And this is when we'll have them swallow the water as we're putting this in, and we discontinue the procedure if they showed any signs of distress. And now we're going to insert it all the way, their head tilted down to their chin. Now that we've inserted it fully, we're going to keep it secured. And now we're going to loosely secure it with adhesive while still securing our NG tube. Alright, now that we have it loosely secured for now, we are going to aspirate and check placement. We can do this with the chest x-ray, and we can aspirate for gastric content. So I'm going to do this. We are going to get our syringe. We are going to insert it and only aspirate a little bit. And with our pH test strip, which we have right here, we are going to test the acidity of the gastric content, make sure it is gastric content. And then according to facility policy, what we do with the rest of this gastric fluid, sometimes you put it back in, sometimes you can just dispose of it. And this is the correct pH for the gastric, what we'd be seeing. Alright, so now I'm going to measure from the tip of the nose, the exposed tubing, all the way down to there. And that is what we document. Now I'm going to reinforce the marking at the edge of the nose, just to see if it shifts while we do our suctioning or anything. And now I'm going to reinforce our NG tube with some adhesive. All right. Now we have it secured. I'm going to tidy up my patient. And now we are going to connect our patient to suction. So we are going to get our suction flow rate set, and we can check that flow rate by doing this. So we're going to connect them to suction, and we're going to put a valve here. All right, now that we have it like that, I'm going to secure this lumen above the stomach, above the chest. We can, depending on the client situation, we can use safety pin or adhesive to secure it. If it was someone combative or something like that, you wouldn't use a safety pin because you wouldn't want them to harm themselves. I'm just going to secure it. Now that we have it secured, I'm going to remove my gloves, perform hand hygiene, report and record this procedure immediately, any proper documentation that would need to be done for this NG tube placement. Thank you.